Hi everybody and welcome to my channel. Hey, a lot of you are maybe visiting me for the first time, and I want to at least introduce myself a little bit. I've been doing therapy for about 32 years. 20 of them I would say were done in the United States under the auspices of the insurance companies, and I worked outpatient. In the United States alone, I probably had somewhere in the area of 5,000 patients. Most, I would say, my patients struggle with mood disorder. That was my number one diagnosis. We also had people who had struggled with addiction. And of course, I did a lot of relationship counseling. So that gives you kind of an idea about what I've done. What I'm going to talk to you about today happens a lot. And it's one of the most scariest mental health crises people can face. And that is panic attacks. I mean, every day, ambulances pulling into the hospital with somebody who has, 140 beats a minute of their heart rate, maybe even higher. They're sweating. They're complaining about pain in their left arm. And anybody that knows anything about medical would assume, and a lot of them are going to have accompanying chest pain. They're going to assume they're having a heart attack. And this mirrors a heart attack so much that people generally end up, calling for an ambulance. And most of the public really don't know how to treat it and don't know the difference. So they get to the hospital. Quite often, what they'll do is just let them sit there. They'll go and triage them. They'll check. They'll see their heart's fine. They check their blood pressure. Blood pressure's up a little bit, nothing substantial. And they'll know right away this is a panic attack. And generally what they'll have them do is just say, look, just calm down, relax. We're going to come to see you. We're just going to let you rest for a while. Doctor comes back 20 minutes later, pulse is way down, and they get discharged. That's pretty much it. One of the difficulties I think that I find in these cases, though, is that they're recommended to go to a psychiatrist. At least initially, to determine, or in some cases, and what I've seen is they might come see a therapist like me to determine the level of care they may need. Panic attacks generally don't need a very high level of care. They may need not just outpatient, but maybe intensive outpatient. Maybe they'll be seen several times a week in the beginning. Quite often, what happens is, though, and this is what we have to be cautious of, is when they go to a psychiatrist, the psychiatrist will give them medication for anxiety and tell them to take this medication as needed. The problem is they believe that they need them a lot. So these mental health medications, these anxiety meds, can be habit forming. And so what happens is over time is people get used to taking the medication, and when they try to wean themselves off of it, guess what happens? They get another panic attack again. So I think it's really important to find out, well, what should I do when I'm getting panic attacks? What's going on? Well, there's two main things that I at least work on. The first thing I work on is what you can do to relieve some of the stress that your life might be experiencing. Sometimes it's as simple as your brain gets crowded with too many thoughts, too many things are going on, and your brain just has trouble keeping up, and it has some breakdown, and then there's some serotonin loss, and when the serotonin gets low, well, you get anxiety, and in some cases they'll go right on to a panic attack. The other thing I would say is some of these things are behavioral, and what I mean by that is that there could be a lot of things happening in your life, either things that maybe you created or things that are happening to you that are causing these feelings, and they're getting worse and worse until they spiral out of control. So typically what I do is I look on two phases. One is you have the organic thing of what's going on in the brain, and then you have the physical, relational, all that stuff that's going on in a person's life. A lot of stuff can be done through therapy, and I highly recommend that you examine this stuff, because in time you could just move past that whole series of problems in your life. And what I mean by problems, I mean the actual panic phase. You can get past that. The biggest thing people fear when they're panicking, if you ask them, is they always say they feel like they're dying. And, nobody wants to die, especially if you're young. You're thinking if you're 40 years old and maybe you don't want to die at that point. And some people do, unfortunately. Some people do have heart attacks and die. But, and I could understand if the feelings that you might get when something that comes upon you. But learning a little bit about how your brain and how your body work and how your environment works is where therapy comes in. It's an educational tool. It just teaches you all about that stuff so that you can begin to do your own therapy. Because you got to realize when you're with a therapist, you might be with them, 50 minutes a week? But the rest of the time, guess who's your therapist? You're the therapist. So if you're not in a good place, your patient's in trouble. So the important thing is to learn not only in therapy from your therapist, but you also want to look at some outside sources. Today, there's so much stuff on like WebMD, so many things you can look at to help yourself get better and start doing a lot of the right things that will bring you out of that. One of the things that I always think of in terms of like a long-term approach is learning the art or the practice of meditation. Being able to get rid of the crowd that's in your brain. Easy way to determine it is just, you can sit on your bed, you can lay on your bed, close your eyes, and look at the black of your eyeballs and see how long you can focus on the black of your eyeballs before thoughts come in. And I suspect they'll come in quite quickly. And you'll say to yourself, my God, where are these thoughts coming from? Well, they're coming from you. But in time and practice, you can get to the place where you can look at the back of your eyeballs in that darkness and be able to stay in that. And the thoughts don't don't come in. Because the more those thoughts come in, the more crowded your brain gets. The more crowded your brain gets, the more likely you're going to experience anxiety. The more likely you experience anxiety, it could play itself out as a panic attack. Your brain's just too crowded. You give a breakdown. Because that's what panic is. Panic attacks a breakdown. The other thing I would say is things like exercise is a great way to relieve some of the pent-up anxiety you experience from day-to-day life. Look, I've been living now in the Philippines for almost 11 years. My life is much different today than it was 11 years ago. 11 years ago, life comes coming at me very fast, I'm driving, fighting traffic, going to work, all the things that you have to do, and everything's within a scheduled time. It's a dog-eat-dog world out there. And it's very stressful. In today's world, too. I'm really far away and I'm watching TV, and I get stressed just watching TV, what you guys are going through in America. This is probably a bigger problem now than it was 11 years ago. I do have a small practice. I don't take a lot of patients, and I charge a very little amount of cash. The reason I do it cash is because I moved out of the United States, I can't get on insurance panel. Just the nature of things. Not only that, but to maintain your licensing, you have to continue to take education classes, and a good portion of them in person. I'm not going to fly back and forth for that. So I practice. I'm a retired therapist, and I can certainly help you with this stuff. I've got a lot of experience in it, and I think that's the big thing. Is there's a lot of new people coming into the field, and a lot of them don't have the experience of dealing with people with panic attacks. They read about it in a book, but I've been in a therapy room with thousands of people with mood disorders. I really do know what it's going to take for you to get to the other side, and I'll be glad to help you. Please hit the subscribe button and hit the like button. Hit the bell so you know when you have another video is coming up. It's really important for you to get me started, because although I have a small practice, I do want to take on a few more clients, and I'd like to get them through this venue. Not only that, but I feel really good in being able to educate the public, because, like I said, ultimately you're going to be the therapist, because you're the one that's with you all the time. You can't take your therapist with you all the time. So I hope that helps you. Take care, and we'll see you on the next video.